Minister.
Yes, Mr. Speaker, I'm considering that.
Please, Honorable Jerry Ahmed, you had your bite. There cannot be a follow-up on a follow-up question. It's not done. Let's move to question number, yes.
Speaker, may I find out from the minister if there are some deliberate policy position of the ministry to assure the nation and also issue the people are agitated about this matter. Can you the minority, we've allowed you to answer all your supplementary questions, but allow the speaker to rule on this matter.
Majority Chief Whip.
Mr. Speaker.
You've heard the indication.
Mr. Speaker, the indication is not your indication.
The question is not about policy. You are talking about policy. Honourable members, let's move to question number B. Urgent question number B. Standing in the name of Professor Kinsley Nyako, Member of Parliament for Kwadaso, and my very good friend.
No, we are more than friends, brothers.
We have the floor.
With occasional fights. The Speaker, thanks for indulging me. Mr. Speaker, thanks for the opportunity to ask the Minister for help. The measures the Ministry is putting in place to expedite the treatment and recovery of Ms. Sandra Barfi-Boateng, who was seriously injured and fell unconscious during the Ghana Armed Forces recruitment exercise held on 12 November 2025 at the Baba Yara Sports Stadium and has been on admission at the Komfo-Anokye Teaching Hospital till now. Thank you, Mr. Speaker.
Yes, Honourable Minister.
Mr. Speaker, I thank the Honourable Member for Kwadaso for the question and wish to assure this Honourable House that the Ministry of Health has remained actively engaged in ensuring Komfo-Anokye Teaching Hospital to ensure that Ms. Sandra Barfi-Boateng receive the requisite specialist care and that every necessary step is being taken to expedite her treatment and recovery. Without disclosing sensitive clinical details, Mr. Speaker, I can confirm that the patient sustained serious injuries during the Ghana Armed Forces recruitment exercise held on 12 November 2025 at Baba Yara Sports Stadium, following which she received inpatient care under specialist supervision. The measures being implemented to support her treatment and recovery include ensuring that her medical bills are fully covered by government so that no cost is passed on to the patient or her family. This has been complemented by comprehensive care delivered through a specialist-led multidisciplinary team, together with the required rehabilitation and related social support to optimize recovery. The Speaker, the patient has since 26 February 2026 been transferred to the 37 militaries to strengthen emergency response systems and improve outcomes for Ghanaians who may be affected by similar incidents. The Ministry of Health remains committed to supporting the patient's full continuum of care. We will continue to work with the relevant health facilities and, where necessary, engage other state institutions to ensure continuity of treatment, rehabilitation, and appropriate follow-up until her condition stabilizes sufficiently for discharge and subsequent outpatient management. Mr. Speaker, I so submit.
Honourable Member, any supplementary question?
Mr. Speaker, I thank the Minister for doing justice to Sandra Barfi-Boateng's situation. Mr. Speaker, I went to visit her about 2 months ago, and her condition is precarious. And I'm also happy that she has been brought to 37 Meter Hospital to receive enhanced.
You see, you also always fight because you refuse to take a cue
Mr. Speaker,
from Order 88.7. You cannot address the House. You have to ask a supplementary question.
This is an emotional.
Whether emotional or not, that will not change the rules.
So, Mr. Speaker, with a response that you are considering the option of sending her abroad, will you expedite that option? Will you consider expediting that option of sending her abroad for enhanced medical care? Thank you.
Mr. Speaker, we will be taking signals from the specialists, so as and when necessary, we will do accordingly.
Yes.
Thank you, Mr. Speaker. Honorable Minister, please, when was the last time you visited this patient at the hospital? And whether you've even visited her before? If so, when? Thank you.
And the question is on measures being taken. What has it got to do with minister's visitation?
It's part of it. The minister answered questions on measures, and I want to find out from the minister whether he's ever visited a said patient in his capacity as a health minister.
Does that question emanate from measures?
The minister is very capable of answering this simple
question. Overruled.
Come on. Minister, you haven't visited a patient?
Yes. Yes, Honorable Habib.
Mr. Speaker, I want to find out from the minister, as part of the measures he put, is it visiting the patient part of the measures?
Question overruled. The minister clearly indicated in the answer that is under specialist care. Honourable members, we thank the minister for responding to the urgent questions. Before we move to oral questions, let's take a message from His Excellency, the President of the Republic of Ghana. Right Honorable Speaker, absence from Ghana. In accordance with Article 59 of the 1992 Constitution of the Republic of the African Court on Human and People's Rights, scheduled to take place on Monday, 2nd March 2026, I will return the same day. In my absence, the Vice President, Professor Nana Jane Opoku Ajiman, shall perform my functions in accordance with Article 68 of the Constitution. Honourable members, it appears this message was read on Thursday, so it's captured by the record already. So the record need not capture this. Yes. Yes.
Thank you for, you know that in this narration, it is possible for anyone and everyone to make mistakes.
Yes.
Yes, so even for you to Speaker. Yeah, I was just doing some calculations with reference to the number of times the president has traveled already.
This is not included.
Yes, it's about 31 already. Speaker, already about 31. And Roxy will come and stand here and tell me, I do not know mathematics, but it's okay.
Yes.
Speaker, this must not be allowed to stay in the records. I told my brother that his mathematics is wrong.
Is hereby ordered to be expunged from the record.
He wanted it to go as part of the record.
Yes. Honourable members, we have oral question also scheduled for the Minister for Health. The first oral question stands in the name of Dr. Kingsley Ajimai. Question number 153. Please, you have the floor.
Mr. Speaker, I come under Order 883 and with your leave and authority from the...
Please ask.
I rise to ask the Minister for Health the plans of the ministry to improve oral health as the 2023 WHO steps.
Honorable member for of the find high percent and poor oral health the Ministry of Health working through 8 agencies is pursuing strategic interventions to expand access, strengthen prevention, and improve outcomes. Mr. Speaker, it is important to note that a number of dental treatments are already covered under the National Health Insurance Scheme. To further improve the situation, the ministry has also integrated the health promotion, prevention, and early detection aspect of dental care into the free primary health care program. This is intended to strengthen community education, promote early identification of oral conditions, and ensure timely referral, particularly for underserved populations. Ghana currently has fewer than 500 dentists for a population of over 34 million, with a concentration in urban centers. The ministry is therefore prioritizing the deployment of more dental professionals to underserved regions and the revamping of the Uniado mobile dental clinics to deliver services to rural and hard-to-reach communities. The ministry is also leveraging technology to improve outcomes by intensifying the use of digital platforms and mobile applications for oral health promotion. These platforms will support public education on oral hygiene and facilitate remote interaction between patients and oral health professionals, especially where in-person services are limited. Prevention and public education are being strengthened through mass media campaigns to promote regular dental checkups, encourage fluoride use, and support healthy age. In addition, collaboration and system strengthening efforts are being intensified through partnerships with development agencies, the Ghana Dental Association, and the international organization to expand research, funding, and training opportunities. The ministry will further develop training programs for nurses and physician assistants to provide basic oral health services in remote areas as part of our broader team-based approach to primary healthcare delivery. Mr. Speaker, improving oral health cannot be left to dentists alone. It requires a whole of society effort involving government, policymakers, communities, and traditional leaders, schools and educators, corporate bodies, and the private sector, and individual citizens. Oral health is fundamental to overall health and well-being, and the ministry remains committed to ensuring that the access to preventive and basic oral health care improves across the country. Thank you, Mr. Speaker.
Member, any supplementary questions?
Thank you, Mr. Speaker. The minister made mention of the fact that some dental treatment is covered under National Health Insurance Scheme. Can you be gracious enough to tell us some of the treatments that are covered under NHIS, please?
Well, you are talking about equipment.